Hello, everyone. Welcome. My name is Katia Figueiredo, and I'm very happy to welcome you today to one of the Innovator Open Market Consultation events. And today, Fundación Pública Andaluza Progreso y Salud takes the center stage with its challenge called eDEMAP. So we are going to start this session with a warm welcome from Bertrand Vert, setting the stage for an exciting hour of innovation exploration. After this, you will gain insights into the Innovator program. This is the driving force powered by the European Innovation Council that fuels organizational growth. And then the moment that you are waiting for, Isabel Barragan from Fundación Pública, Andaluza Progreso y Salud will present a pressing challenge that requires an innovation solution. Obviously, as an open market consultation event, the attendees are more than welcome to take part in the discussion and engage with the speakers in the Q&A part of this event. And you will have two ways to participate. So you can either raise your hand, and in the Q&A part, we will give you the ability to unmute yourself. Or if you prefer, you can simply use the Q&A box to write your questions, your comments, your remarks, okay? One final practicality, so this session is being recorded. This is for dissemination purposes in the scope of the Innovator project. So without any further ado, I would like to introduce you Bertrand Vert from the European Innovation Council, who will share a few words about today's event.
Bon dia, good morning, Katia and everyone. Very nice to see you this morning again. So we continue our series of open market consultations that you, Innovator Consortium, led by F6S, TIC Biomed, Civitas, you're organizing, and we are delighted, us, the European Innovation Council, to support you in doing so. So indeed, let me recall a little bit why the European Innovation Council is launching these kind of initiatives, is dedicating some budget, supporting you guys to run this program. The idea is that in Europe, procurement, and here talking about public procurement, in other words, what all the public administrations, organizations from all over Europe are buying on an annual basis, represent a serious share, an important part of the European GDP. It is also something like 15% in total at European level. It varies from certain member state to the other, but still it represents a huge bulk of money. We are talking here about something like 2 to 3 thousand billion euro per year. So we can imagine, we can hope that at least part of this huge public investment goes towards innovative solutions. Goes towards supporting the development of new products or services. And why we are hoping so? Because in this case, it can benefit from both sides. It can benefit for the suppliers of these innovations, meaning all companies. And here we are targeting SMEs and startups in Europe, the one member of the European Innovation Council, but not only. All the other ones, they are 20 million, by the way. And on one side and on the other side, we can hope, and we have evidences that it works, that it brings innovative solutions to our public organizations in this case, and in this very case, to the health system for a very important region in Europe and in Spain, talking here about Andaluza. And it is key for the people on the ground, for the one taking care of the others, for the doctors, the nurses, all the hospital people making the hospital a reality, it is important for them to have indeed the best solutions, devices for their daily work, and also in order to deliver the public service they want to deliver to the people that need it, the patient in this case. So you see, that's part of the beauty of innovation procurement. If we can, in one shot, deliver two sides, and that's the reason why EIC is working on this. Indeed, it's not always easy to run such public procurement of innovation, to match both sides. And here the intention of InnoBuyer is to actually bring some fresh money for both sides, for the suppliers and for the one that are paying for it, the procurers. So that's the journey where Centro de Innovación de Salud, or Centro de Salud de Andalucía, is engaged, and we are very happy about it. So very curious to know more about it from Isabel Barragan, and yeah, be sure that the EIC, all our companies, and further than that, and us personally, the EIC managers, we are delighted to organize such events, but also we are very engaged to deliver even more for you. So just follow us, follow the next open market consultation that will be organized today and tomorrow again. You will find them on the F6S platform, on the EIC platform, and yeah, stay tuned. Thank you very much, Katia. Back to you.
Thank you, Bertrand. So before we move to the challenge presentation, let me just give you a few words about what is InnoBuyer. So InnoBuyer is a 3-year project that is funded by the European Commission via the European Innovation Council. Okay? And this project is being implemented, as Bertrand previously said, by 3 different organizations, so F6S, CVITA, and TIC Biomed. And if we try to present InnoBuyer in a nutshell, we can present it like this. So InnoBuyer brings together public or private organizations that we call challengers, and innovative SMEs that we call solvers. And jointly, they co-create innovative solutions. And InnoBuyer takes place in 4 sequential steps. So InnoBuyer first helps organizations to identify and to describe their unmet innovation needs. Second stage, to identify and describe these innovation needs, and then find and connect them with the innovation suppliers to co-create pilots with these innovative companies. And finally, InnoBuyer offers legal support for these organizations to prepare a tender to purchase these solutions that were co-created. Okay? And as you can see, there is funding support associated to each one of these 4 actions. Up until now, we have been working with a selection of 15 challengers, okay, supporting them to improve the description of their unmet innovation need. And currently, we are in the 2nd phase of the program, where we are helping challengers connect with innovation providers via initiatives like the one that we are here today, via these open market consultation events, for example. For innovation providers, there will be a call. Okay, so very soon you will be able to propose solutions to the InnoBuyer challengers by applying for a call for solvers that will be launched still in this month of October. And the selected applicants via this open call will get up to 58.5K to co-create a pilot with a challenger. And this will take place in a 10-month period. So our suggestions, stay tuned. to be aware as soon as this call for solvers is launched by following InnoBuyer channels, okay? And now let's move to the most interesting part of this event, okay? The one that what you are waiting for. I would like to introduce you Isabel Barragan from Fundación Pública Andaluza Progreso y Salud that will present their challenge.
Hello, thank you very much, Katia, for the introduction. I will share my screen. And now I will start the presentation of the challenge. Well, as Katia has introduced, I am Isabel Barragan, and I'm going to present the eDEMAP challenge, which is the management tool for the digitalization of the early demand map. This challenge is presented by Fundación Pública Andaluza Progreso y Salud. And first of all, I would like to talk you a little bit about the organization. Fundación Pública Andaluza Progreso y Salud is a public organization which belongs to the Andalusian Regional Ministry of Health and Consumer Affairs. As you know, Andalusia is one of the biggest regions in Europe, and it has actually the largest healthcare system in Europe, with 1,500 primary care centers, almost 50 hospitals, and 16 health management areas. In the system, we have 120,000 employees. So I just wanted to give you this information so you can have an idea of how the healthcare system is. And here in FPS, in the Fundación Pública Andaluza Progreso y Salud, our biggest aim is to boost health research and innovation in Andalusia. And we have different departments, and one of the departments that belongs to FPS is the Public Procurement of Innovation Office. Here in the Public Procurement of Innovation Technical Office, we are working for the implementation of the Public Procurement of Innovation in Health program, and we are developing and managing several procurement of innovation projects. And we also are leading an initiative which is called the Early Demand Map of the Andalusian Public Health System that has been recently, 1 year ago more or less, it was launched. And here we are working for the identification, the evaluation, and the prioritization of innovation needs in order to develop public procurement of innovation projects based on real needs. So, having said that about our organization, I would like to describe our challenge and how the situation is solved right now, and what is the current scenario. Here you can see a graphic where I will explain how the process is developed right now. I mean the process of collecting innovation needs for the development of this early demand map. Right now, we are doing it, the needs collection, we are doing it in a static way, let's say, because we do on-site workshops that are composed on 5 steps, as you can see here in the screen. First of all, we organize the workshop called Open Workshop, which is attended by 40 professionals from the Andalusian public health system. In these workshops, we discuss with them about the innovation needs that they may have, based on a methodology which is based on open innovation practices. And here we are trying to bring from them what they think they need. But it has to be innovation needs always, right? After these first workshops, we in the office, we work with the professionals of the healthcare system to further define the innovation needs that they have already identified in the open workshops. And then we go to the mind workshops. In these workshops, we have attendees from the system, of course, and also from private entities as companies or SMEs, or from research centers or universities. Here we contrast the information that we have collected in the open workshops, and after that we transform that needs into challenges with the professionals, of course, of the Andalusian public health system, who are the one who brings the innovation needs of the system. And after that, as a final part, these proposals, these innovation needs that have been identified and now transformed into challenges are sent to an evaluation committee that evaluate the innovation needs and that rate them and prioritize them. Because after that, what we want to do, what is actually the final goal of the early demand map, is the implementation of possible public procurement of innovation projects based on real innovation needs. That's why we are doing these workshops, to identify them and then to transform it into challenges, and then to look for funding through public procurement of innovation calls for funding. Having said that, I would like to share the goals of our challenge. As we have said, the challenge is the co-creation of a tool that allows the digitalization and the complete systematization of the early demand map. The challenge, the main goal is being able to move from static formats that are the ones that we are doing now in the on-site workshops to more dynamic ones that will allow a system that is more attractive and agile for users, that will allow a greater professionalization of the work that we carry out here in the technical office as public procurement of innovation project managers, and that ultimately will allow a greater impact on the Andalusian public health system, since it will accelerate the implementation of public procurement of innovation projects. Then, as specific objectives, we have settled those that you can see: the digital compilation and the improvement of needs, the digital evaluation and prioritization of needs by an experts committee, and the digital management of the whole process by the technical office. And now I wanted to show you the requirements that we have settled so far. First of all, we have defined three different kind of users for the possible solution that we would hopefully we would co-create. The users would be the professionals from the Andalusian public health system, first of all. The second type of users would be the managers of the public procurement of innovation technical office. And the third type of users would be the evaluators, all right? Then, having in mind these different kind of users, now I wanted to show you the sections, the possible sections that we have thought about, that we have thought that the solution could have. The first section is the health innovation needs sections, which will be the place where the professionals from the public system will submit or upload or the needs, the innovation needs. Then the second section is where the evaluation and prioritization is made by the evaluation committee. The third section would be a challenge repository where we could see all the needs that have been evaluated already. And the section number 4 would be the management and data exploitation section, where would be available for the technical office. So we can see and we can manage and we can monitor how the process is developed anytime. Then we have set some compulsory requirements, which are the basic requirements of a management system for users, like the registration, login, permission, and roles, etc. Then different functionalities adapted to the different types of users that we have showed in the previous slide. Then some management functionalities for the technical office, like calendar, Gantt, and so on. And we want also we would like to have information exchange channel which will allow to send notifications and alerts to all the users that are part in the process. And we would like to be in a friendly interface. And of course, we would need to do it in Spanish language, like with more priority, because as I said before, the Andalusian public health system is composed by 120,000 employees. So not everyone speaks English. So we would like to have it in Spanish before. And then as desirable requirements, we would like to have this translation service from Spanish to English, as well as an optimization for multi-device access to like desktop, but also especially to access by a mobile phone. And we would like also as a desirable requirement to be able to have a categorization of the challenges by specific health areas. Then after the co-creation of the solution, we have thought that we should do a pilot based on a creation of a target group in one of the strategic lines of the Andalusian Public Procurement of Innovation in Health program, which would be more or less done in 1 to 6 months. Then the professionals from the Andalusian Public Health System that would be part of one of the on-site workshops would submit the needs to the tool. Then in the technical office, we will curate needs proposals and send feedback to the professionals from the healthcare system. And then the evaluation committee will be able to go to the tool and to do a proper evaluation through it. Afterwards, after the pilot is done, we would like to do a survey that we will submit to the different types of users to see what we can improve. And also, of course, we will give feedback to the solver about any modifications, because in case we will need to change anything. And as I said before, the challenger, the Fundación Pública Andaluza Progreso y Salud, belongs to the government of Andalusia. So there are some requirements that comes from the regional government, and we have to follow its guidelines and for the digitalization of such a process like the one that we are proposing here. Here I wanted to show you the more direct impacts of the challenge. Where the main one is the reduction on the overall time from the identification of needs to the end of the process, because if we can do it from through a digital tool, the needs compilation can be done at any time from anywhere. So the management also from our side, from the technical office, can be done as well at any time from anywhere, because we can see the process evolution on the platform. And then the evaluation committee can also evaluate the needs, the proposals in a faster way. We as well can do this, can see this ranking and can start the looking for funding phase much sooner if we have a digital tool than how it is now with the on-site workshops. And we think that another impact of our challenge is the user satisfaction, which would be regularly measured by satisfaction surveys to the different types of users, as I said before. On the other hand, we think that the challenge that we are proposing here is a big business opportunity for the SMEs that might be interested in co-developing it with us. Because on the one hand, we think that the solution that we are seeking here is a scalable solution to other organizations that are in charge of identifying needs, innovation needs, or any type of needs. With this, I mean that it can be scalable to other healthcare systems at a regional, national, and international level, to other regional governments. For example, in Spain, we have 17 different regional governments. So maybe it can be scalable to these kind of entities as well, and also to private organizations that can carry out the same activities or similar activities. Another point that we think that is a business opportunity, that is a reason of the business opportunity that we are presenting here, is the commitment that our organization has shown, because the Regional Ministry of Health and Consumer Affairs of Andalusia has already proved the commitment of the regional government with the public procurement of innovation in health. That's why the eDEMAP initiative was launched, because it has this support, and this is another reason of the high commitment that the government has in this challenge and in the public procurement of innovation projects in health in general here in Andalusia. The last slide is I wanted to show some questions for the attendees. First of all, I will read it all together. So, and then afterwards you can answer if you wish. I wanted to know if is it clear the purpose of the challenge, and I wanted to know as well if in the presentation is there anything that we should explain better, and then moving to the specifically to the solution that we are seeking for. What, in your opinion, would be a good solution for the challenge? Is there any other solution requirement that should be implementing that we haven't said? And what could be the main barriers for the development of this solution? So now I think I will give the floor to Katia again, so she will see if there's any question around.
Thank you, Isabel. Yes, that's it. We are now entering the Q&A part of this event, the part where we want to hear feedback from the attendees at home. As we said at the beginning, we invite you to participate in the discussion in two ways. So you can either raise your hand, and we will give you the possibility to turn your mic on and provide your feedback to the questions that you are seeing on the screen, or making other questions that you would like to understand better. Or if you prefer, there is the Q&A box here in Zoom. You can simply type your question here in the Q&A box, and we will answer your question. So for this Q&A part, I will bring to the discussion Elena Lopez, our partner from TIC Biomed, who has been working directly with this challenger, and also from another colleague of Isabel, we are also joining to the discussion Carmen Garcia to take part. So I can see that the first question has arrived in the Q&A box. So let me read it. Do you currently use any solutions or systems to tackle the challenge? What are these solutions? Why don't they work?
Okay. Yeah, actually, so far we are not using a solution of that has the features or the requirements that we are asking for, because the eDEMAP initiative started at the beginning of this year. So we have done so far 4 workshops. We are going to do 4 more in these last months of the year. So far we have not used such a tool. We are doing it in the on-site workshop and then by email. That is why we have found this need in the initiative that will definitely improve how everything is collected and how the information is managed.
Okay, thank you, Isabel. While we wait for other questions, so I recall you can either raise your hand for the possibility to talk or send your question, comments in written form via the Q&A. I will maybe invite Elena to join the discussion to provide some feedback also.
Thank you, Katia, and good morning, everyone. So, Isabel, I was wondering if you could explain why the early demand map is so important for the Andalusia region, and also as a proxy, how many needs would you expect to receive, for instance, in a year or in a 6-month period? You went through this aspect in the presentation, but just for the attendees to understand the strategic importance that this tool is having for the Andalusia healthcare system.
Okay, sure. Yes, regarding the first question, the early demand map of the Andalusian public health system has a strategic importance in the region, because we think that this is a way to be far. I mean, what we want here is to know what the system needs, what are the innovation needs, but we want to know it directly from the healthcare system that work in the system, and also from another innovation sector actors that are around, like SMEs or like in universities, and of course from patients. So this is very important, because we want if we want to improve the healthcare system that today we have, we should develop some innovation projects that of course will improve the services, and the patients ultimately will improve also the attention that they receive in the system. That is why the early demand map is very important for the Regional Ministry of Health and Consumer Affairs, and also it's one of the main parts of the Public Procurement of Innovation in Health program that we have. And actually, here I answer the second question regarding how many needs we would like to identify. Currently, in the process as it is developed right now, we are identifying many needs, because in our on-site workshops, many things come out, and many discussions are developed. But after the proper work that we do with the professionals from the healthcare system on the needs description and on its turning the needs to challenge process, we are doing more or less like 40 proposals per year, what we want to do actually, because so far we have almost 20, because we have completed half of the workshops that we are going to complete this year. So if everything goes all right, and for the first, if the solution is also developed, for the first year of implementation of the solution, we would like to at least have 40 proposals, let's say, to prepare to present to funding calls after this evaluation process, and after this all the process that we have discussed in the previous slides. But this is something that we would like to make bigger. So it's a number to start with, and then hopefully we would like to have more, of course.
Thank you very much. I think this can clarify a lot to the attendees. I'm seeing another question in the chat box related to the system. I don't know whether you want to read it, Katia.
Yeah. So are you looking for a new separate solution or an add-on to your existing system?
Actually, we are looking for a separate solution, but it has to comply, let's say, to some basic technical requirements that we have, since we are part of the regional public, I mean, of a public system. But it will be a separate solution because so far we don't have anything like that.
Mm-hmm. On this, I have a comment or question, Isabel. So during the presentation, you mentioned that the solution will have to comply with the digitalization guidelines that are set by the ministry, of course, because you are a public organization. Mm-hmm. And I was wondering whether this is something that is available through a web link or in a document that you could share with interested companies. Is it?
Yeah, sure. Yeah, I think it's available because everything at the end is handled by the not handled, but yes, it has to be authorized by the Andalusian Digital Agency. So I'm sure they have some public guidelines on it. I will look for because I don't have it here yet. So I will look for it and I can maybe post it on the website on the discussion panel. And then we also have, because Manolo Cobo is a coordinator of, is part of the IT department of the Fundación Pública Andaluza Progreso y Salud, and he will probably answer so much better than me. But finally, he couldn't join us today. So that's why I will look for the specific link of the guidelines to post it on the website. And if anything else on it on this topic comes out, I will also ask the attendees to post it also online so we can answer there directly.
Yes, exactly, Isabel. So the discussion won't end by the end of this session. If other questions arise, or if you are seeing the recording of this session and you cannot obviously participate, if you have questions, so you can use this event page at F6S, so the page that was used to receive registrations for this event has a section called discussion. The link is now on the chat box, and you can use this section to ask further questions that you would like to have answered or to provide additional details.
Excellent.
So I saw that someone raised the hand, but seems like that person had to leave. But I have, okay, I can see one hand raised now, Aline. I believe you would like to add something.
No, sorry, it was a mistake.
Okay. So we have another question in written form. So does the solution have to run on your servers?
Yeah, this is something that would be definitely further detailed during the co-creation process. But so far, our idea would be to run the pilot in the cloud, and then afterwards, after the launch it of the solution, we would like to have it on our server. Yeah. But as I said, this is something that would be further discussed in the co-creation phase of the challenge.
Perhaps here we could pose a question to the attendees. What is more convenient for them based on their experience implementing digital health solutions or digital solutions in general? Would you prefer to have it within the healthcare organization servers, cloud systems? Would you prefer to run the service on your own? I don't know, any comment on that? We can take it in written or you can raise your hand as Katia explained.
Don't be shy.
Because as you know, the aim of this open market consultation event is precisely to learn from potential solvers from market players like you. And if there is something that is not clear or that is too challenging or that you would have a suggestion to make it better, it's the moment, because now is when we can consult and make adjustments to our plan. So Here, we are listening.
Beautifully explained, Elena. So this is the moment before the challenge is published in the call for solvers, and by then the challenge will be closed. All the specifications will be closed. This is the moment to hear from you what could be improved to suit better both the challenger as well as the solver needs.
Mm-hmm. Okay. Meanwhile, I have a thought on that, and let us know if you have any comment. Meanwhile, I was wondering, Isabel, you mentioned that you would need different type of user access, and that type of user access will have different functionalities associated to them. So could you summarize which, I don't know, 2 or 3 types of user type you envision?
Yes, in general, we have 3 different types of users, which are the first of, I mean, the first type would be the professionals from the Andalusian public health system who should be able to submit or to upload the innovation needs to the solution. Then the second type of user would be the evaluators, which are part of the evaluation committee, and that should be able to evaluate the innovation needs through this platform, through this system. The third type of user would be ourselves, the managers of the technical office, and because we would like to have access to the whole process to see and to monitor how the submission of the evaluation need is going, how the evaluation process is being developed, and afterwards to see this ranking of innovation needs, and to be able to go for the look for funding phase, which is the ultimate goal of the early demand map, to look for funding for the innovation needs that we have in order to solve that innovation needs through public procurement of innovation projects.
Excellent. Okay. Very well explained. I also have another question. So perhaps a bit more philosophical, so to say, but if you could summarize, what would be your ideal solution in 3 words? Like, what is really a must, what it needs to contain for you to work? Which words would they be? Like 2 or 3? For instance, user-friendly.
Yeah. I think that it has to be, of course, friendly and attractive. And also in line maybe with the visual identity of the early demand map initiative. But I think that the most important thing is to be accessible. Let's say, people knows what they are supposed to do, and it's easy to understand, and is with graphics and with functionalities that can facilitate the process, not doing it more complicated, let's say, than it is right now.
Excellent. Okay.
And from the user's perspective, how open do you think they are to these sort of innovations? How easy it will be for them to use this type of innovations?
Actually, that's a very good question, and also is connected with the one that Elena has asked, because one of the main issues, or not issues, but yeah, one situation that we have is that these users, the people from the workers, the professionals from the Andalusian public health system, they are very, very busy because they are doctors or researchers or managers that has their daily work in hospitals or in medical centers or in labs. So they don't have much more time to have extra work. So I think they are very open to this, Actually, we are asking around now in the on-site workshops, because this is something that would facilitate the process. So having in mind that they are very much busy because of all the clinic and research work that they are doing, this will give them many more facilities to do this innovation needs collection, let's say.
Okay.
Perfect.
Yeah. So we recall that the floor is open to any of the attendees that we have here following the conversation. We would love to have you joining, taking an active part in this this discussion, to receive your inputs on what is being discussed. If you agree with what is being discussed, if you have questions, remarks about something that either isn't clear or you foresee in a different way. So this would be the perfect moment to have you joining, and either by raising your hand or providing your feedback in written form in the Q&A box. We still have some minutes left, so let's take advantage of the opportunity of having Isabel here today to answer questions you may have.
Mm-hmm.
Otherwise, seems everything is super clear.
And everyone is ready to submit their application, right? Okay. So, Isabel, I was thinking now that, as Katia explained, for the co-creation, we will have a 10-month period. And by that time, we need to split between the development itself and then to do some testing. Mm-hmm. And I don't know, perhaps you didn't think about this yet because it's not the time, but or already you have an idea. How would you like to test the solution? So how many users will you onboard? Who will be the people testing that the tool actually works or not?
Actually, as we think that we would like to do it with the professionals that are part of the on-site workshops, for example. Mm-hmm. Like in the eDEMAP, we have 4 strategic lines, which are digital transformation, environment and health, biomedical engineering, and precision medicine. On each of these 4 strategic lines, we organize 1 open and 1 mind workshop. So for the pilot, we have thought that we could use we could do it in a specific strategic line of the program, and then we will do it with a target group of many, I don't know, 10, 20 people. I'm not sure. This is something that I would like to decide. We would like to decide with the SME during the co-creation phase how many people they think that are good to be in the pilot, because maybe, I don't know, 20 is too much or not. I'm not sure, but we want to do it with the real people. I mean, the real professionals that are going to be part of the early digital map. Mm-hmm. And also with some of the evaluators as well, and with ourselves as the managers of the technical office.
Excellent. Okay, thank you very much.
Thank
you. Okay, so last call for questions. Just to make sure that everything is clear before we close the session. No?
I will have one question for the attendees, but as they are shy, I'm not so sure they will answer, but I encourage you once again. Do you believe that with the funding that is available and the time that we have for the co-creation, we mentioned 10 months, it will be enough for addressing this challenge? Or I don't know, what are your thoughts in terms of a scope and budget provided? That would be something that I would be willing to know.
Yeah. And as was said, the co-creation period is 10 months. and the funding available in the call for solvers is 58.5K to support these innovative SMEs.
So for the attendees to know, all the funding is the same for the 10 challenges that will go through the co-creation in Innovayer, and they've been trying to adapt the requirements that they are posing to the market so that it fits the time and budget. But we don't know, sometimes we can think that things are easier or that are more complex than what they are in reality, and you, the market players, are the ones that know better whether it is feasible or not. So that would be something that would be interested to know.
So first feedback, Elena, received. It seems feasible.
Well, good news. Good news. Then. Good news. Okay.
No other comments, I see. Neither hand raised. So unless the colleagues here would like to add some final remarks, I think we can move to the final part of the session, because everything seems to be clear by now to the attendees. Okay, so
just to mention that Katia explained this, but just for all the attendees to know that the challengers in Innovayer also get legal support as a last part of the project to launch a procurement. So in the event that the co-created solution is successful and the pilot results are promising, they have committed to work on a tender to acquire the solution. So it's not that the process ends here. We are looking beyond the end of the project, and we really want to introduce the innovations within the challenger organizations that, as you know, they are public organizations who very much need this type of solutions to improve the services that we receive as citizens. So think of the business opportunity as well.
Thank you so much for reminding this, Elena. That is very important. So we are now reaching the end of this session. No more questions. We see no more questions, so we can close this session. Let me, of course, thank all the attendees who joined and provided feedback to some of the questions. That is super important for us. And of course, thank you to Isabel, to Bertrand, for all the speakers here today. Just a few reminders before we close. As we said, the conversation doesn't have to end here. If after this event you have questions, or if you are seeing the recorded session and you have things that you would like to ask or to comment, you can still do this via the event page at F6S in the section called Discussion. Okay, as mentioned, this month of October, we are launching a call for solvers, and this challenge that we had here is one of the challenges that will be available for you to apply to tackle. So make sure to subscribe, to follow Innovayer channels so that you don't miss the announcement. And as soon as the call is open, you are aware of it, and you can start reading all the information that we will provide and preparing your application. So make sure to follow Innovayer newsletter, website, social media, so that you are immediately aware of the launch of the call. So that's all for now. Thank you so much once again to all of you, and have a nice day.